But, Mr. President, with
people
all due
are
respect,
paying-
you've been talking about fixing the health care insurance plan
and you
since
can't do it
2015.
because of the Democrats.
But
That's
since
right.
2015, you've said you'd
I've been
fix it.
talking about it for a long time. We almost did it. We were one vote short. We would have had great health care.
Now see, he's relying on you to not remember what he's talking about here, but we're not going to let that happen. So let's go back in time really quickly. When the Affordable Care Act was passed in 2010, about 50 million Americans had no health insurance. Costs were skyrocketing. Premiums had more than doubled in the decade leading up to Obama's presidency because we have a for-profit healthcare system that doesn't view healthcare as a public good, unlike every other high-income country in the entire world. And millions were locked out of coverage altogether if they had a pre-existing condition, things like cancer or asthma or pregnancy or even domestic violence injuries. Insurance companies could just say, nope, you're too high risk. Because of how broken the system had become, Obama ran on healthcare and won. He passed the Affordable Care Act, and as a result, about 20 million Americans gained access to coverage. Insurance companies could no longer deny people with pre-existing conditions, and costs were reduced for millions of low to moderate income Americans through subsidies. Republicans did not like this. They immediately framed the ACA as a government takeover, and over the next several years voted to repeal or defund it more than 60 times. But with Obama still in office, none of those efforts actually succeeded. But then Trump took office in 2017, and the Republicans put forth their own healthcare plan. Remember Paul Ryan? And the plan was basically just repeal Obamacare, eliminate subsidies that help lower income families, push people with pre-existing conditions into high-risk pools where their premiums would skyrocket, and expand HSAs that primarily benefit higher income Americans. All told, the CBO estimated that plan would kick 23 million people off health insurance. But it famously failed by a single vote in the Senate when Senator John McCain, despite his differences with Obama, cast the deciding no vote. His reasoning was literally that Republicans had no replacement plan. It would just kick a bunch of people off healthcare coverage, and that's still true today. There hasn't been a comprehensive Republican healthcare proposal since. If you remember, Trump never released a plan in this election cycle. He said he had concepts of a plan. It's just to repeal Obamacare and get more people off health insurance. That's the plan. Which is what they did with the Big Beautiful Bill last July, where the CBO estimates that 10 million people will lose healthcare coverage as a result of its passing. As part of that, the Republicans did not extend expanded ACA subsidies, which is extremely unpopular with the American people. Now the Democrats, as they do, have conceded based on a promise of fair negotiations by a party who has no intention of fairly negotiating this issue. And as a result, millions of people will see their health insurance premiums double or more next year. And when that happens, many will drop coverage altogether. That means fewer people getting preventive care, more delaying treatment until they're seriously ill and using the ER as their primary care office, and hospitals facing rising uncompensated costs, which get passed down to all of us. The result is a sicker population, higher long-term healthcare spending, and deeper health inequities, where wealthy people have a healthcare system that works and everybody else gets left behind.